Today I will talk about the virus that is the dengue virus. First of all, the pronunciation of the word, is it dengue or dengue? Yes, it is the dengue, not dengue. The dengue virus belongs to a group of viruses which are known as arboviruses. So the arbo is the acronym for the arthropod born, and the family of the dengue virus is the flaviviridae, genus is the flavivirus, and the species is the dengue virus. The classification regarding the arboviruses is that it includes the three families: the flavivirus, the flavi, the toga, and the bunia. The flaviviridae includes the yellow fever virus, dengue virus, and the hepatitis C virus. Toga family includes the chikungunya and the robavirus, that is also known as the rubella. The chikungunya, the few months ago, the cases of the chikungunya happened to occur in the big city of Karachi. So the chikungunya and the robaviruses, they are included in the toga variety, and bunya variety that includes the encephalitis virus, that is the Japanese encephalitis virus. Just like the arboviruses, there is another term that is known as the roboviruses. So the robo is the acronym for the rodent-borne, and these viruses, the roboviruses, they are transmitted directly from the rodents to the humans without an arthropod vector. In the arboviruses, the vector was the mosquito. Here, in case of the rodent, in case of the roboviruses, the arthropod vector is absent. The transmission occurs when dried rodent excrement is inhaled into the lungs, and this leads to the respiratory distress syndrome. Regarding the structure of the dengue virus, it contains the different proteins, the different antigens, numbering from 1 to 5, and NS is the non-specific proteins. So NS for the non-specific proteins, and they include from the NS1 to the NS5. So these are the antigens which are present in the structure of the dengue virus. The dengue virus, the dengue virus, the, the this is a global problem, and this infects the 50 to 100 million people worldwide in a year, and the mortality rate varies from the classic type of the dengue fever to the dengue shock syndrome. So the mortality rate of the classic dengue fever with treatment is less than 1%, and without treatment it is about 1 to 5%, and it increases in the dengue hemorrhagic fever. This reaches to the 10%, and in severe case, in the severe form of the dengue infection, that is the dengue shock syndrome, the mortality rate is about the 26%. So there is the rise of the mortality rate from the classic dengue fever towards the dengue shock syndrome. Some factors play a major role in the spread of the dengue virus infection, and these are the overgrowth, or the population growth that is rapidly increasing in worldwide. So the populated areas, they have the populated cities, they have the role in the spread of the virus, the dengue virus. The rapid urbanization, the international traveling from the endemic areas, and the global warming, these are the factors which have role in the spread of the dengue virus infection. Some are the predisposing factors, and these are the babies and the children. They are more liable to be infected. So the younger ages are predisposed, and the women are at high risk as compared to the men. The patients with the diabetes mellitus and the patients with the bronchial asthma, they are at the high risk, and they are predisposed. So these are the predisposing factors. An aircraft for the dengue. This is an aircraft for the dengue. This is a mosquito, and this mosquito is different from the Anopheles mosquito that that causes the malarial fever. And this mosquito is known as the Aedes aegypti. The type of the mosquito in case of the dengue virus is the Aedes aegypti, and likewise the malaria, here the female mosquito that is infected and that causes the dengue virus infection. So the mostly the females are the dangerous. So anyway, the dengue is the most common insect-borne viral disease in the world. So I am focusing the viral disease. So the dengue is the most common insect-borne viral disease in the worldwide. This is the magnified image of the Aedes aegypti, and you see the whitish spots on the legs and the body of the mosquito. So this is the peculiarity of this mosquito, the Aedes aegypti. There are the different dengue virus types, and these are the DEN 1, DEN 2, DEN 3, and DEN 4. So the four serotypes of the dengue virus, and the serotype 1 is believed to produce lifelong immunity. However, it can be, the patient can be infected with the other serotype in future. So the concomitant infections with the different serotypes may occur. The dengue transmission cycle, this one shows the interplay between the three factors. This is the interplay, the interaction between the three factors, and these are the Aedes aegypti mosquito, that carries the virus, and that carries the dengue virus, and then it infects to us, to the human beings. So this is the interaction between the three factors: the mosquito, the virus, and the people, the human beings. So watch out this mosquito, it is Egypti. They have some important features, and these features are that it is an urban mosquito. The Aedes aegypti is an urban mosquito, and it bites during the daytime, and we are unaware of that. And it lives or loves in a fresh water in homes. It lays eggs preferentially in the jars, the discarded containers, the coconut shells, old tires, and it breeds around the year. It breeds around the year. So the breeding occurs around the year, and the favorite zones are the tropical regions like the Pakistan and India. So it is not our greatness. So we shouldn't be proud of that, and we are the favorite zones for the dengue virus. The dengue infection, it represents in the different ways, and there are the clinically three forms of presentation, and the first one is the simple dengue fever. That is a classic form common among the dengue virus infection, and the other two, the dengue hemorrhagic fever, in which the plasma leakage is less than 5%, and the third one is the dengue shock syndrome. The plasma leakage is above the 5%. So these two these two are the recurrent complications of the recurrent infection of the dengue virus of with the different serotype. The mostly the usually the simple dengue fever, or the classic form of the dengue fever, is subsides and the patient recovers. How the classic dengue fever happens to occur? It is Aegypti, the mosquito that carries the Den virus, bites the human beings, and this virus enters into the white blood cells, and the the cytolysis, the destruction of the WBCs occurs, leads to the leukopenia, and there is the release of the different cytokines, the especially the interferons, the interleukins, and the tumor necrotic factor, which leads to the high grade fever. And usually the fever subsides after a week, but the weakness persists. However, the recurrent infection, the reinfection or the recurrent infection with the other serotype will cause the dengue hemorrhagic fever or the dengue shock syndrome. Now the what is the classic presentation, and what do we experience when we are infected with the dengue virus? There is an abrupt onset of flu-like symptoms, and the fever is more than 2 days and less than 10 days. So this one is a essential criterion, and we experience the headache, that is the retroorbital headache, and the myalgia, the arthalgia, and the severe backache, bone pains. So this the dengue fever is also known as the breakbone disease or breakbone fever, and and the facial flushing occurs. The maculopapular rash also appears on the body, and the patient has the bleeding tendencies, the manifestations. There is abdominal pain, and the urinary output is reduced in spite of the adequate fluid intake. And if the infants are infected, they are irritable, and the lymph nodes are enlarged. This shows the bleeds in the conjunctiva of the patient. These are the bleeds. These are the bleeding in the conjunctiva. Here are the skin bleedings in the lower limb, in the feet and the lower limb. If there is a severe form of the dengue virus infection, that is the dengue shock syndrome or the dengue hemorrhagic syndrome, the signs of the significant dehydration occurs, and these signs are the tachycardia, decreased blood pressure, narrowing of the pulse pressure, and the oliguria, and the increase in the capillary refill time, that is more than 2 seconds. So these are the signs of dehydration. If the dengue virus infection is severe, as the dengue hemorrhagic fever or the dengue shock syndrome. Regarding the differential diagnosis of the dengue virus infection, the dengue fever, the classic dengue fever is are these are the conditions which are included in the differential diagnosis of the dengue fever, and these are the malaria, typhoid fever, the measles, and the influenza. So in case of the typhoid fever, the measles, rubella, the maculopapular rash appears on the different parts of the body. So these are included in the differential diagnosis of the dengue fever. Coming to the diagnosis, the laboratory diagnosis, which laboratory the investigations are needed. The routinely we do the CBC, that is the complete blood count, and this shows the abnormalities, and these abnormalities are leukopenia, thrombocytopenia, and if the bleeding manifestations or the bleeding tendencies are present, then the thrombin time, the prothrombin time, and the APTT and the FDPS, they are also investigated in order to observe, in order to see the bleeding tendencies. So the liver functions test are they are also performed. And in the severe form of the dengue virus infection, such as the dengue shock syndrome, also the serum urea creatinine and the electrolytes, they are also assessed, and blood gas analysis is also performed. And if there is the if there is the evidence of the plasma leakage, the ultrasound is advised, and and the urine analysis also observed for the protein leakage in the urine. So these are the investigations which are advised by the consultants. The serology is an important criteria for the diagnosis, the laboratory diagnosis of the dengue virus infection. If the case is acute, if the patient is coming to the consultant in the early stage, in the acute stage, the anti-dengue immunoglobulin M is seen. So this indicates the acute phase of the dengue, classic dengue fever, and the non-specific antigen 1. This also is present in the acute phase of the dengue virus infection. So these both indicates the acute phase of the dengue virus infection, and this one, the anti-dengue immunoglobulin G, if it is present, this indicates the chronic phase or the later phase, the after the 10 to 14 days. This is present in the serum of the patient. The precaution or the supportive prophylaxis is needed, such as the mosquito screen, the mosquito nets, and the repellents. They are needed in avoid to avoid in order to avoid the mosquito biting. The aspirin is contraindicated, and the painkillers may be given. The steroids, they are also contraindicated. The plenty of water and salt, they are required, and the children below the 12 years, they are watched for the complicated form of the dengue virus infection, and no antibiotics are needed for this virus infection. No vaccine is available for still no vaccine is available, and the patient is maintained for the fluid intake, usually the deoxycycline or the ringolactate. These are given to the patient in order to maintain the hemostatic of patient. And if the dengue shock syndrome or the dengue hemorrhagic fever, the platelet transfusion are given in these severe forms of the dengue virus infection. Thank you very much for listening.